I'm Morne Christou,
And I'm Dr Frans Cronje.
and you're watching The Dan Show, your healthy dose of dive safety tips and more. In this week's episode, we'll be discussing equalizing techniques and are you fit enough to dive? With that said, how's it, Dr. Frans?
Morning.
So, shall we explore this topic about equalizing? You know, there are many folks that say they struggle to equalize, or many times they say one ear equalizes before the other one, or people just say, I always have a pain while I'm diving kind of thing. Is it that they have problems with their ears, or possibly they haven't cleaned it for a while?
That's a good one, Morning. Well, of all the calls we get on the Dan hotline, ear problems certainly are the most common. So it is something that divers deal with from time to time, and we've got some great materials on the Dan blog that I'd like to refer you to. There's actually a detailed 20-minute self-assessment video clip that walks through the different ear equalizing techniques. And I'd really encourage not only novice divers that may have some difficulties with their ears, but instructors to go through it to see how they could teach their students how to equalize. So it's not just for the novices, but of course instructors, we encourage you to actually make that available to your students. So what I'd like to say today is not going to be a repetition of what they could get in a far more formal format, but maybe some of the things that come across our path that divers aren't necessarily aware of. You mentioned the issue of people equalizing and feeling the one ear equalizes more easily or rapidly than the other.
Yeah.
That's actually quite common. In fact, as you're watching this, if you were to pinch your nose and equalize, you'll probably notice the one ear goes a little bit faster than the other. It's true for about 50% of people.
Okay.
That is due to a variety of things. We have a nasal cycle. Every 2 hours, one side of our nose engorges. It's one of the reasons why we turn in our beds at night. It has to do with the nitric oxide cycle. So that's one of the reasons why that may be the case. The other is that there may be some structural differences, for instance, a deviated nasal septum. Those can sometimes cause issues. But what I often find in terms of divers complaining that the one ear gives them hassles is not actually an eustachian problem at all.
Right, because that's usually where people sort of
That
head towards, isn't it?
that is the case.
Yeah.
And the telltale is you'd ask the diver, well, can you not equalize? And they'll say, no, but I can equalize, but that is always sore, is always getting sore. And that usually is my cue to the following. Now think it through with me. For your eardrum to become painful, it needs to be stretched to a point where the nerves actually record pain.
Yeah.
Now, if your eardrum can take up a lot of slack because it billows a lot, then it's going to take a while for the volume reduction, according to Boyle's law, to reach the state where it actually is painful, right?
Yeah, absolutely.
Now we assume our ears are symmetrical because, you know, the surface anatomy is usually symmetrical, but that's not the case with the eardrum.
Yeah.
The eardrum may be very different, so you may have one stiff eardrum and you may have one eardrum that's a bit more floppy.
Okay.
And the stiff eardrum is going to be the one that's going to record pain first.
All right.
You can equalize it easily, but it's going to prompt you to equalize more frequently. And that's not a problem. It's not a disability. It's not even an abnormality. It's a reality. The divers just need to be aware of. So if you can equalize the eustachian tubes, but you find the one ear is giving you a few hassles, that's probably it. And just bear in mind, that's the ear that you need to consider as your rate or descent limiting ear.
Okay.
And yes, you can always make it a bit easier to equalize that side by tilting your head so that the ear that struggles points upwards. It's got nothing to do with lighter buoyancy, it's just literally stretching the muscles in the neck that makes it easier to equalize. Good question, thanks Morne.
Yeah, well, you know, I remember watching or listening to one of your lectures at a dive shop a few years ago, and people also had many questions about eustachian tubes, and you then went through different sort of equalizing techniques, which I know in the blog post you referred to, but there's a strange kind of a thing that people can do, and I think if I recall, strengthen the eustachian tube. It's an autovent or something to that effect. It really looks odd, something you stick in your nose and then blow up a balloon. I don't know, does that really work?
That's a good point. In fact, there are two things that I would probably recommend for people who do have some issues with their ears and need to make it easier for themselves. Now, of course, I haven't got one here, so you're going to have to use your imagination.
Sure.
But the Otavent, which is something you can buy, we've usually had to import it from overseas, or you could make your own if you just have a look at what it's like. It's essentially a nozzle with a round tip that seals against the nostril, and attached to it you've got a balloon. So what a diver would do is you'd hold the nozzle against the nostril, pinch the other nostril, and literally inflate the balloon.
Yeah.
It would require about the same pressure that you would expect to clear a snorkel that's full.
Okay.
It shouldn't be much harder than that, otherwise it can damage the inner ear. But what it would do is it would allow you to sense how hard you can blow, but there's a second component to this. As the balloon is now inflated and you swallow, the process of the pressure of the balloon and the swallowing gets those eustachian tubes going. Now what I've found, people that previously had to pop Sudafeds when they go diving, what they find if they've done this 3 times a day for 7 days is they don't need the Sudafed anymore.
Oh, wow.
And the indication is that the opening resistance in the eustachian tube decreases. A substance called surfactant, which is almost like a detergent, actually is increased, and it makes it easier to equalize. So that's the Otavent. The other one that I could mention is any one of different forms of sinus rinse. There are many combinations of saline, and our grandmothers used to tell us half a teaspoon of salt, half a teaspoon of sugar, half a teaspoon of bicarbonate of soda on 500 milliliters of cooled boiling water. And in fact, that is pretty much the solution.
Spot on, yeah.
And in the past, people have, honk it down.
Yeah.
But what these devices do is they allow you to literally douche the back of the nasopharynx. I mean, it does look a bit weird because you've got this squirting up the nose, running up the other side. But what's good about it is it irrigates the mucus that sometimes overlies the eustachian tubes. And some people do struggle with thick mucus. Maybe it's a low-grade milk allergy. Maybe they just don't have enough fluids, and they should rehydrate more. But the sinus rinse or its equivalent really, really makes a difference. So those are two things to consider.
Yeah, they both sound a little gross, but if they do the job, I guess then it's good. Yeah, so just before we move on to the next topic, Dr. Frans, many times people dive, they burst the eardrum, and they continue diving. Does that have an impact on the diver's health, or is it okay to continue diving, or should you rather abort the dive, back up, and go see a doc?
Yeah, that's an excellent question, Morne.
Yeah.
Ear perforations or rupture of the eardrum is actually fairly common with diving. And unless there's an underlying problem with equalizing, which means that this isn't a once-off event, this person has an ongoing issue with ear equalizing, maybe because of allergies or polyps or growths or something else, that would put them at risk to future ear ruptures. A simple ear rupture not only heals very well, but heals in a way that you are not more vulnerable to future ear perforations at all. So with a due assessment, usually 6 weeks after perforation, in which most ear perforations heal spontaneously, you'd probably be ready to go diving again. But as usual, have it checked out. Just have someone assess your eardrum, make sure you can equalize, that there's no weakening of the eardrum. But no, it's not an end of diving sentence.
All right, but once the drum's been perforated, best not to get back into the water, I guess.
Well, certainly not diving with the eardrum perforated, if that was the question. There are some people that dive with modified earplugs and protecting masks and so on with perforations. We don't recommend that because if you lose the seal and water comes in, not only is there a risk of infection, but the temperature of the water can cause a tremendous amount of vertigo, and people can lose their orientation underwater, become nauseous underwater, or literally get in trouble. So we don't recommend that at all.
All right. Well, there you go, guys. Another hot topic always, is fitness to dive. And, we see a range of different shapes on the beach or at certain dive sites. And I guess it's only human to sometimes want to judge, But what is I would say, the quick fix to know whether I'm healthy enough to dive?
Well, it's a relatively complicated question for a number of reasons, but I will actually answer it.
Okay, well, good.
I will actually answer it, so if you can just hold on for a moment. First of all, the issue is of what is the standard of fitness that recreational divers should be held to. In years past, a notable American cardiologist and diver, Fred Bovee, led to the standard of so-called 13 METs being a prerequisite. Now, just to dumb that down somewhat, a MET means the amount of energy output at baseline. Like we're sitting here, this is 1 MET. So as we increase our physical activity, we'll click on 2, 3, 4, 5, 6 METs. And it works out roughly 1 MET per kilometer per hour walking. So 7 METs would be 7 kilometers per hour. 13 METs would roughly be walking or jogging at 13 kilometers per hour. So according to that standard, a diver should be able to jog at 13 kilometers per hour for about half an hour to be considered fit to dive. If we were to apply that standard to most divers today, we'd probably lose half our diving population. And the reality is that most dive situations don't require it, because that's what would be necessary to fight off a 2-knot current. So in reviewing these standards, the norm has slipped down to about 7 to 9 METs. So now, to answer your question, if you are able to maintain 7 to 9 kilometers per hour on a treadmill for about 20 minutes, then you should be fit enough to dive under, let's call it, normal conditions.
All right.
Now, that does not exclude issues related to cardiac disease, hypertension, and all the other risks that may be involved as a result of medical illnesses. But just on the concept of fitness to dive, that would be a metric that people could at least apply for themselves. It's better than giving them no recommendation. That's something that you could start with.
Yeah, at least a measurement, I guess,
Yes.
you know. But now, you know, so I go do a dive course, I have to fill in some form to say whether I've got some issue medically related. If I say, no, I don't have anything, then I'm good. And that's kind of where it stops.
Yes.
Do you think that there should be maybe a stricter approach or more disciplined approach towards fitness to dive, or being healthy enough to dive within the diving community, I guess?
You raise a very important question, and I'd really like Louis in a future show to maybe address this. But the reason for any form of medical assessment is really as a result of the indemnity or waiver requirement of a dive school. In other words, they want to ensure that the diver was made aware that certain physical restrictions might have health or safety implications. And by the person completing a self-assessment questionnaire, whether truthfully or not, they have assumed their understanding of that risk. Now, if they were to indicate that they have an abnormality, then the dive school, dive training organization or operator is obligated to then have that verified. And that would then typically result in either a referral to a diving physician, or at times just a call to the hotline to clarify whether it's really a risk. So we need to understand that the reason why we have anything to do with the medical assessment is largely because of the waivers and the liability. Having said that, we do want divers to be in good shape, because there's another aspect to being fit to dive. And this is what divers often forget. If you dive with a medical condition and something happens to you, you are putting the entire dive operation and your buddies at risk. So you're basically being selfish. You are jeopardizing not only your own life, but you are actually abusing the social right that you have to rely on a buddy coming to your aid. And I think that we should really start suggesting that this is the way we should see it. You're being negligent towards your buddy. You're being selfish. You're being unconsiderate, rather than seeing this as a medical burden or a medical standard that is just a hoop to go through. You're being responsible. You're being a good buddy. And that's the attitude we really should have, I think.
Well, I think it's going to be interesting to get Louis' view on this and see where possibly the future might lead, whether this would be a requirement in the future to, you know, maybe go for a dive medical on an annual basis or every 6 months or whatever. I guess especially if you're an instructor or a dive master, you know, helping people. But I think the general diver should consider doing that in any case. But, you know, at this stage, each to his own, I guess.
Well, the health and wellness aspect of Dan is really something I've always hoped we could put forward. We had hoped that at some stage we would even be able to get some discounts from the insurers that extend the group policy benefits to us if we could show almost like some of the medical aids are doing. You know, if you are complying with certain fitness behaviors, then they give you the benefit of that. We haven't reached the stage that we could do that, but at least we'd like to give people recommendations to look after themselves, and a diving physical assessment is a good way to do that, and of course assures that not only are you fit to dive, but you're fit in general.
Well guys, that wraps it up for this week. For more information on fitness to dive and equalizing techniques, please do check out the Dan blog. You'll also find a lot of content in the Alert Diver, which you can find via the Dan website, and that's dansa.org. And who are you?
I'm Dr. Frans Cronje.
I'm Morne Christou, and you watched The Dan Show.